Hey guys, you're watching the Best Practices Show, where we take a look at the best business practices from the best dental practices all over the place. And if you're doing full implant predictability, predictable dentistry, you're going to want to know what are some of the keys for long-term predictability when it comes to implant prosthesis. And I have one of the world's experts, Kimberly Daxon. I call her Kim, from the Dawson Academy. You do not want to miss this. So do me a favor, grab a pen and hit the share button. We'll see you in a few seconds.
The Best Practices Show with Kirk Barrett is brought to you exclusively by ACT Dental, the ultimate provider of dental practice management solutions for dentists and their teams. ACT Dental is committed to helping you build a better practice and a better life. If you're looking to grow your production, motivate your team, get back on track, and create the practice you've always dreamed about, look no further. Give us a call at 800-851-8186 or visit us at actdental.com.
Hey guys, welcome back to the Best Practice Show. Thank you so much for watching. Thank you for downloading, and thank you for always requesting shows that you want to see. And again, today is no exception. We've got some great stuff on here, so you don't want to miss this. Now, couple show notes. We are shooting this live on Facebook. So if you have questions and you're watching the live feed, add your questions to the feed, and I'll make sure we ask Kim directly while we have her on the show. Or if you watch us later on, we watch the metrics, and a lot of you are watching this later on in the day or even in the evening. Continue to add your questions to the feed, and we're going to make sure you get the most out of these. So because we always want these to be valuable, and you can add them, add this information and use it when you go back to your practice and make it useful. So and again, if you've been watching the show, I'm a big fan of the Dawson Academy. Dr. Peter Dawson was one of my early influences on my path as far as education goes. And so it's just been a treat to have a lot of the faculty members. And today we've got Dr. Kim Daxon, who's one of the senior faculty members from the Dawson Academy. And you not only are a senior faculty member, but you teach a lot of the team courses, don't you, at the Dawson Academy, correct?
I do, for hygiene and assistance, my other passion.
Awesome. Awesome. Now, I've watched you become this great instructor and influencer in dentistry. I know who you are, but if somebody's watching this and they don't know who you are, Kim, can you give us a little bit of your story and your background, and how did you get to become affiliated with the Dawson Academy? I'd love to hear your whole story.
Sure. Well, I am a prosthodontist by training. I went to UNC Dental School in Chapel Hill and then up to Boston at Harvard and the VA. For a 2-year pros program. And when I graduated and moved back to Florida, I'm from Florida originally, an opportunity came about when Glenn DuPont and Whit Wilkerson were looking for an associate. And I really did not know that the Dawson Academy or Peter Dawson were in St. Petersburg, and I live in Tampa. So through a mutual periodontist, I was able to connect with Glenn, and my career, my professional life started. That was back in the late 90s. So I joined that practice, and we all practiced together for a long time. And that's just really where my exposure came from.
That's awesome.
Such a fortunate experience.
Yeah, absolutely. Now, there are just a few people that may have never heard of the Dawson Academy. Give us a little synopsis of what the Dawson Academy is and what you guys do, because you guys train dentists all over the world, correct?
Yes, we do. Originally, the headquarters were just in St. Petersburg, but there was a vision that Pete had many years ago to have an international presence. And basically, I would say in a nutshell, the philosophy is treating the patient first and treating the patient completely, looking at all of the systems and really just understanding and knowing how to solve our patients' problems. And the Academy really gives students a very clear, precise way of doing that through the curriculum.
Yeah, absolutely. And we're going to use the word predictability a lot today, because that's one of the things that's going to keep you happy as a dentist. But Kim, before we get into the how, let's talk about the why. Why is the predictability and full arch implant, prosthesis more important now than ever?
I think it's more important now, Kirk, because implants have been around for a long time. And I would say in the mid-'80s is when Brandemark really started making a push. And we've seen enough cases now where at the time when Brandon Mark started, implants were site specific, meaning implants went in where the bone went in. And that wasn't always the right thing from a tooth position standpoint. And so now we know that implant dentistry needs to be prosthetically driven. And so I think some of the failures, they're so costly and time consuming, we can't afford to have failures. And so I feel that the main way to get predictability is establishing the correct tooth position first.
Yeah, absolutely. And you and I were talking about this. There's not a lot of people out there that are teaching excellence and restorative or predictability with dentures. I mean, we've got Turby Phil, who I've known for many, many years and one of the greats, but not a lot of places where you can go, correct?
I agree. You know, Turby Phil's been doing it for a long time. He's one of my greatest mentors. I've learned pretty much everything I know from him. But I think students, what I've heard is they're having a hard time finding resources, you know, that especially that are hands-on, where they can go take a class and learn how to fabricate dentures in a conventional way.
Yeah, absolutely. And now let's go into this, because dentures aren't the only answer. Sometimes they are part of the solution, or maybe an early segment. Give us your philosophy on that.
Well, I think for patients who are contemplating implants, either because they don't want to have anything removable, or they already have dentures and they're dissatisfied with their current dentures, I just feel that implant dentistry, sometimes there's a period of time where we need to help patients understand that wearing dentures is the right thing to do. And it's really the only way that we can establish the correct tooth position before the implants go in.
Absolutely. And now you do get a lot of patients that come in and go back to what you said before. They're unhappy, but let's talk about why they're unhappy. And is it a lot of it aesthetically driven? Is it functionally driven? Maybe a combination of both?
You mean unhappy with dentures?
Yeah, with the dentures that they've received, or maybe a little bit of their dental history before they get to you?
Yeah, I think there are some people that just don't want teeth that come out. I mean, if I really think about it, I don't know that I would want teeth that would come out either. I think their anatomy sometimes precludes them from wearing dentures successfully, and that's where implant dentistry can really help support those patients. And, you know, there's a financial investment as well. And I think the nice thing about implant dentistry is we can offer patients all kinds of ranges, from dentures that have implants that just snap in to full arch, non-removable teeth. So I think there are many reasons why patients are unhappy. And maybe it's because the dentures just aren't fitting well to begin with. So.
Yeah, absolutely. And dentures aren't going to go away. I mean, a couple things that we always talk about on here is one of the biggest problems with this country is not necessarily healthcare or the economy, but it's the aging population. And so as a dentist, you've got to understand that some of the patients that you have are going to be under your care a lot longer than the dentists that came before them. And dentures aren't always for a particular type of patient. You mentioned, sometimes it's the failing dentition that offers a great solution for some of these patients that come into your office.
Absolutely. And I think with the failing dentition, that's a little bit of a tougher category and even more critical to determine tooth position, because when we think about teeth that are failing, oftentimes they're not in the right position, either due to periodontal disease, the teeth have migrated and moved. And so again, utilizing dentures to establish, and the one thing I love about the Dawson Academy and the Wizard Diagnostic Wizard program, and some of the things that we offer in helping us to determine exactly what the right tooth position should be.
Yeah, absolutely. Now, I love the Wizard. One of the questions that I get from young dentists is sometimes they think they need every level of technology in order to be able to do this the right way. But that's not true. I mean, you don't need every piece of technology. You can do it on some of the most simple elements of technology, correct?
Absolutely. And just a camera, just getting some simple photographs and looking at rest position and high smile and buccal corridor. There's a lot of information that we can get just from a simple series of photographs in working with the lab, who also understands, where the teeth should be. Right.
Now, another question that we do get is the mix of services that go in great restorative dentistry. So give us the truth of maybe your practice, because you don't have full mouth cases coming in every day saying, hey, look, I know who you are, blah, blah, blah. You've got a good mix of general dentistry. You do some dentures, and then you do some other, give us some scope of what you see on a regular day as a clinician?
Well, I think because of my prosthodontic training, I choose not to do certain things such as root canals and surgery, but I have 2 full-time hygienists. I have patients that come in that are in their late teens and early 20s who really don't need a lot. I think the important thing in that group is identifying what Pete calls the signs of instability, so that we're helping them, we're preventing them from getting to the other class of patients that we're talking about who need implants. And so I kind of have 2 passions at the end of the spectrum: the younger adults who I feel like we need to save, and then the other patients, which, that occasionally they come in that need full mouth rehabs. I do fillings and crowns and simple things. It's just really trying to help solve patients' problems in the easiest, simplest way.
Yeah, and you're not doing this in a hurry. Like you're getting to know these patients when they come in. I've often argued, I want you to speak to this. Most people could do great restorative dentistry if they just slowed down and took the time. Would you agree or disagree with that?
I absolutely agree. And I think that's one of the challenges we all have. I think we kind of get caught in the rat race of production goals and trying to say yes to every patient and fit every patient into the schedule. The biggest thing I learned from Pete was to slow down, and really, even if you just start with the new patient exam, if that's the starting point, and allow the time for the new patient exam, that will feed and perpetuate your practice in a great way.
Right. Because it's the opportunity to really get to know the patient. And it's not so much about the data, it's more about connection than anything when you're spending time with these patients. What are some, if you were to talk about pitfalls in the future, because we're seeing trends, and I'm sure you guys are seeing this at the Dawson Academy. You got a lot of younger dentists now placing implants, more so than ever. Would you agree? They take a course. What are some of the errors or pitfalls they make when they go, oh, I took this course, I know how to place and restore my implants? What are some of the mistakes you see people make?
I think that the emphasis in the draw is implant dentistry because it can be very lucrative. What I feel is lacking, and what I know from some instructors in dental schools, I think the denture technique and helping them understand how to get the teeth in the right position, I don't know that that's still being taught completely. And I think that's where the missing link is. So these younger dentists want to get out there, they want to do the implants and place them, but understanding the prosthetic challenges that we have, I feel is a weakness in our curriculum.
Right, because everything, like you mentioned before, is aesthetically driven now more than ever.
And prosthetically driven, knowing where the teeth need to be before the implants go in. And that's based on the aesthetics and the appearance, but also speech and also function. Those 3 things need to be determined prior to the implants going in. Absolutely.
So now you had mentioned there's a couple of things that you actually do. Like we mentioned Implant Concierge. Just tell us a little bit about that. Now that we're not promoting it, but it's been one of those things that's been a gift to you in your practice, as well as I've heard some other faculty members mention it also.
Yeah, Implant Concierge is a company that's fairly new to me in the last 6 months, and I know John Cranham's been working with them quite a bit, and it's designed specifically more for the surgeons, but I think it's a great, there are other companies like them, but what I like about this company is their fees are very fair. It's a service company that helps us plan and design the placement of the implants and the prostheses. And so I've had a few opportunities to work with them through some of my surgeons, and I just would encourage, to use somebody like them to help plan these cases, because we just can't afford for things to go wrong.
And exactly what do they do? I'm still a little, I'm not so familiar with them, but what exactly do they do?
So Implant Concierge is a company that provides CT scan reads. They will look at the CT scan with the surgeon. They fabricate the guides if we want to do a surgical guide for a guided technique when we're placing implants. Laboratory technicians on staff that help them to design and plan the cases. And so they can take you all the way through the treatment planning process up through the guide fabrication.
Okay, awesome. And then, you were talking about the continuum. You guys are actually developing the denture continuum or curriculum that'll be out in the future, right?
Yes. Our hope is to have a denture course available hands-on, probably by the end of 2018 or early part of 2019.
Okay.
I'm really excited about that.
Awesome. Awesome. Any other things that you would say to a young dentist? Now, we see some younger dentists. We also see some mature dentists in their careers. We've got dental students watching this. You've had a great career in dentistry. What are some of the best pieces of advice you would give a young dentist maybe watching this that might be looking at 3 or 4 decades ahead in dentistry?
I think the future of implant dentistry is huge. And I think for the younger dentists, I would encourage you to take on the task of finding a technique to fabricate dentures and taking the time to learn it. It's interesting to me how many dentists really do not enjoy making dentures. Mm-hmm. And that's part of my research now, is trying to understand what the pain points are. Some of it might have to do with insurance reimbursement, just the time that it takes clinically. It does take time. Dentures are not easy to fabricate. And so my goal is to really help dentists who are struggling with that, make it a little bit easier for them.
Yeah, absolutely.
Implant dentistry that they want to do.
Yeah, awesome, awesome. Well, like I said, I really appreciate you being on. Is there any other thoughts, last thoughts that you have on this? Okay. Now, if you haven't seen Kim teach, you have to check. I mean, watch how she does what she does. And your course in May. Tell us about the course that you have in May.
The course in May is with John Cranham. He developed the course, and my role in that course is talking about dentures. But basically, the course is full arch implant planning and prostheses. Implant Concierge will be there. We just had a course in October, and it's treatment planning and understanding when to treat the immediate or the failing dentition. All on 4 technique, if that rings a bell to some of you. And it's a full 2-day course. Okay. Really great information.
Yeah, and where's that course going to be held at?
In Chesapeake, Virginia.
Chesapeake, which is a beautiful place. Absolutely, good stuff. We're going to post a link to those references that we made during the course of the show, so you're going to want to check them out. And Kim, I know people are going to have questions for you. How can they find you if they want to reach out to you and ask you some specific questions on anything that we've shared on the show at all?
I am on Facebook. You're welcome to email me at daxon@daxondentistry.com. That's probably the best way to get a hold of me.
Awesome. Awesome. Well, I appreciate you being on the show. So thank you so much. So stick around while we say goodbye to everybody else. And if you're watching the Best Practice Show, I really appreciate continuous, to give us great feedback on the things that you want to see. If you enjoyed what you saw today, which I know you did, do me a favor, just hit the share button. We'd obviously love great information like this to get out to your friends and protect this great profession that we love called dentistry. And, keep watching the Best Practices Show. We'll see you guys later and have a great rest of your evening.